Another part that helps us with our vision is through rods and cones. So rods are what are around the edges of the retina, and they help us to see low light levels and but they cannot distinguish colors. So they can see like light and dark, but not the specific colors. Cones, on the other hand, are located in the central region of the retina or the macula, and these are dense and located in the fovea. They help us to see detailed and colored vision. So being able to see even this picture on our screen is due to those cones. They allow us to see normal light conditions, and there are different types of cones. So there's short or blue, and there's middle or green, and then I'm not sure why the third one is not showing up. But there is also the long cones. So we'll talk about those in a minute. But these rods and cones, again, are helping for vision. So the light is entering the eye, where it is then, part of what our vision comes from are these rods as well as those cones. And so kind of both of these working together for us to be able to see what we see on the page right now. So part of our eyes is also that fovea, which is the small depression in the retina, and it comprises about 50% of the visceral cortex in the brain. So what this does is it provides the highest level of visual acuity due to the distribution of cones. And so those cones, again, helping with our vision, with our ability to see sharp and clear images. And so if there was any damage to this area of the eye, it would result in loss of central vision, or what is also known as macular degeneration. So you may have heard of that before, and that is due to damage to the fovea. With visual impairments in eye structure, we're going to talk about each of these different types on the next slides, and how, again, different things can impact our eye and our vision. The first one is amblyopia, which is when a child has what's commonly known as a lazy eye, where one eye does not develop properly because the other eye is stronger and causes this eye dominance. And so what may happen is that the other eye has difficulty tracking or staying on track with the stronger eye, and it causes what people commonly call a lazy eye, but that's amblyopia. There is also another condition called strabismus, which is where the eye points in different directions. And so you can see different types depending on the location or the direction of the eye. This is particularly common among children, usually can be corrected by doing different things to strengthen the eye that is looking in different directions. There's also optic neuritis, which is where the optic nerves becomes inflamed. So you can see on the left what a normal optic disc would look like and what the vision would look like. And then when that optic nerve is inflamed, what the vision looks like. So it's blurry. You can see almost kind of like a circle around that part of the eye. Usually it's due to an overactive immune system, where the individual basically has sudden loss of vision. It can also cause pain and movement of the affected eye. And so something definitely to have your client look into if they're starting to notice this blurred vision that happens quickly, and they don't really have an understanding of what, they don't know why it happened. It just happens quickly. Then they should go to see the doctor. It might be due to their immune system, or could also be due to multiple sclerosis, some type of infection, again, autoimmune. It could be methanol poisoning, B12 deficiency, or diabetes. So seeking medical attention is really important. And then they'll give them steroids to help in correcting the problem. There's also astigmatism, which is where the cornea or the lens is incorrectly curved so that light is not focused properly, causing that kind of double vision that somebody may experience with astigmatism. And so you can see again on the left what it looks like with astigmatism, and then on the right what it looks like without astigmatism. So that double vision and those light lines when it's dark out may be a sign of astigmatism, and so something to look into. There's also diplopia or double vision, where somebody sees double, not due to, usually not due to the stigmatism, just due to that condition. So this occurs when a person sees double images where they should only be able to see one. The images can either be side by side, one on top of the other, or both. With this condition, as you may imagine, it definitely affects things like your balance. Because of seeing double, it's difficult like to go up steps or down steps to see where you're walking. Also, movement can be affected, and then reading ability. So imagine if you were to look at, reading something and it was 2 A's, that would be very difficult to be able to read. If double vision affects just one eye, it is called monocular. And if it affects both eyes, it's binocular. There are different treatments that are available depending on the cause and the type, but they include eye exercises to kind of help in strengthening the eyes, specially designed glasses that help in eliminating the double vision, and also in some cases surgery. So it depends on the individual as to what would be most appropriate. There's also occipital lobe damage. So visual perception systems is centralized in the occipital lobe. Any significant trauma to this region, maybe a traumatic brain injury, can cause subtle to severe changes in visual perceptions. And so definitely something, somebody has some type of traumatic brain injury, it may affect their vision if the damage occurs in that occipital lobe. So the one is scotomas, which is partial loss of vision or blind spot. So this would mean when somebody is looking that they have basically like a black part or like a loss of vision in a certain part of their eye. So when they're looking, part of their vision is blocked. Similar to how they say like in cars, you have blind spots where you can't see cars, but this is within somebody's normal vision that they're unable to see certain things. There's also visual field deficits and visual hallucinations, so seeing things that aren't there, or distorted perception. So maybe thinking things are closer or farther away than they actually are. With visual hallucinations or distorted perceptions, so this may mean that somebody has an object that's lacking color or having abnormal coloring. It could also be depth perception. So for somebody, say they're driving, you want to know how far you are from the car in front of you. And with somebody with a depth perception issues, they may be thinking that the car is farther away from them than it is, or closer to them than it is. And so that can lead to difficulties with driving, with balance, all of those things. And then also objects may appear bigger or smaller than they actually are. So that's can be common with a visual hallucination or distorted perceptions. There's also word blindness or writing impairments. So there's alexia and agraphia. These are caused from lesions in the parietal temporal occipital association area. So, parietal lobe, temporal lobe, occipital lobe. And so for this individual, so say, for example, they had pure alexia, this would mean that they have a severe reading problems, while other language related skills, such as naming things, oral repetition, so saying, if you said no ifs, ands, or buts, they would be able to reply no ifs, ands, or buts. And auditory comprehension or writing are typically intact, but they have difficulty with reading information and being able to retain it. Say they were reading a book, they'd have difficulty telling you what happened in that book if they had pure alexia. There's also agraphia, which is an acquired neurological disorder, which causes a loss in the ability to communicate through writing. So this could be either due to some form of a motor dysfunction or an inability to spell. With agraphia, it's the loss of ability to write, whereas aphasia usually refers to the loss of ability to speak. So we talked about that when we talked about neurological disorders, where the person was having difficulty, that word scramble with talking. And then alexia is the inability to recognize words that you once could read. So graphia, writing, aphasia, speaking, alexia, word recognition. And so all of these are common conditions that are caused by some type of neurological disorder. Alexia and agraphia specifically related to parietal temporal occipital association. With talking about the eyes, another thing to consider is the eye muscles. And so I mentioned earlier, you can train the eye to strengthen those muscles, which can help with certain conditions. So we have lots of different muscles within our eyes, and those can be related to certain conditions as well. So understanding the different parts of the eye can be helpful too. One condition that someone may have is ocular motor nerve palsy. So this is palsy or paralysis to the third cranial nerve, which can impair eye movements and the response of pupils to light. So this, or it can affect both. With this type of paralysis, it can occur when pressure is put on the nerve or the nerve does not get enough blood. And so it could be due maybe to a brain tumor in some conditions. It could be due to a blood clot. But with this condition, so ocular motor palsy, nerve palsy, it can cause double vision, eye misalignment. It could cause a droopy eyelid, as you can see in the picture. It can also cause an enlarged pupil that does not react normally to light. And it also you can see it in symptoms where the individual may have a tilted head posture to compensate for the binocular vision difficulties. So kind of compensating for that inability to see on that side. So another common condition you may see. Another thing to consider when we're talking about the eye is visual acuity. And so that can be observed through doing a visual acuity test. So where they are examining how well somebody can see. So you've probably heard of, normal vision or 20/20 vision. So what that basically means is that a person with 20/20 vision can read the lines circled at 20 feet away. So they can read this line at 20 feet away. Somebody with 20/60 vision, on the other hand, can read what a person with 20/20 vision could read at 60 feet away. They can read at 20 feet away. And so a little bit different than maybe what you thought it meant, but pretty interesting to see how that works. So you can take a picture of this if you'd like to kind of help you in remembering that. So this again explains kind of what that means. So the 20/20 vision, what they can see at 20 feet away. Someone with like 20/40 vision or less, this would be that they have what they can see at 20 feet away. Somebody with 20/20 vision can see at 40 feet away. And legal blindness is 20/200 vision or less. And so if you ever have the chance to, do a visual acuity test, you can kind of measure and see where you fall as far as your level of visual ability. Not something that we measure as recreational therapists, but if you were to see that in somebody's file, it would still be important to understand what it means. So if someone has legal blindness, what does that actually mean? There's also progressive diagnoses, so things that progress over time. The first one being that macular degeneration. So this is where the macular part of the eye slowly breaks down and produces this blurry vision, which can also cause some loss of vision in the central part of the eye. So this is what it looks like. So that inability to see kind of certain parts of the eye, or that blurry vision due to the macular degeneration. And then the other one is cataracts, which is clouding of the lens that causes cataract. This usually leads to blurred vision, and if untreated, it can lead to blindness. So this is what you can see for somebody with a cataracts, so normal vision versus having the cataract, so it's that blurred vision. And then you can see as well, the amount of light being able to enter the eye for somebody with a cataract is a lot smaller, so that also leads to difficulty as well. The next one is glaucoma, which is pressure in the eye that increases and can lead to damage to the optic nerve and eventually loss of sight. So you can see this is what the cavity should look like. If there is glaucoma, that pressure in the eye builds up. And so it can cause a lot of damage to that optic nerve due to the amount of pressure. And it's really serious, and something that they test for when you go to do eye exams to help in preventing that from happening, so they can detect it and make sure that your eyes are healthy and no issues. With visual impairments, incidence prevalence, it's among the top 10 most common disabilities in the United States and one of the most prevalent disabling conditions among children. About 21 million Americans have some form of a visual impairment. 14 million are over the age of 12 and 7 million are less than 17 years old. So about half of children in the US have some type of visual impairment, also have a disability. So kind of interesting to keep in mind. Another study looked at students to see, based off of their visual impairments, which ones were most common. Or what do they use? So Braille was used about 7% of the time, print readers about 32% of the time, auditory readers about 10% of the time, non-readers or symbolic readers about 32% of the time, and then pre-readers about 16.4% of the time. And so just kind of interesting for, younger individuals, students, what was the most commonly used types. Some secondary issues that are problems that individuals with a visual impairment may have. Diabetes is correlated with visual impairments because of the specific type of condition and how it may impair vision. And so for individuals who are unable to manage their diabetes, they may lose their vision in some cases. Also arthritis, hypertension, which again makes sense because of that pressure from high blood pressure, heart disease, hearing impairments, falls are all commonly have higher rates of having a visual impairment. Also, there's comorbid conditions, so things like depression, diabetes, having a hearing impairment, stroke, falls, and cognitive decline may be comorbid conditions with a visual impairment. So things to keep in mind. Another thing that I thought was interesting, so you've probably heard of this before, but somebody can be nearsighted or farsighted, and then they'll wear glasses to correct that. So if somebody is nearsighted, that means that they're able to see things close up, like reading a book would be easy for them, but seeing things far away would be more difficult. And so what happens in these cases is that where the light hits the eye, it doesn't hit at the back of the eye like it's supposed to. And so it makes their far away vision blurry. And so they would use a concave lens to be able to correct their vision so that the light hits the right part of their eye. Somebody who's farsighted can see things that are far away, but would have difficulty with things that are close up, like reading a book would be more difficult for somebody who's farsighted. And so for them, the light goes further than it's supposed to past, the back of the eye. And so for this person, they would need a convex lens, which would correct that difficulty. And so both would be able to see normally. So another thing just to keep in mind when you're hearing about nearsighted and farsighted, it can be a little confusing to understand at first, but that's what it means. Okay, now we're going to watch a video about what's in store. I thought it was just kind of interesting when we're talking about visual impairments and things to consider. So we're going to watch that quick.